So in Module 6, we're going to continue talking about specific types of neurocognitive disorders. So as you might recall, in the last module, we talked about Alzheimer's, we talked about Lewy bodies, and the frontal cortical portion. So what we're going to pick up with is more motor disturbances. And the first one we're going to see is vascular neurocognitive disorder. And what we see with vascular neurocognitive disorder is small strokes that occur over a period of time. And if their sites are scattered in different areas of the brain, then you're going to produce more of a cognitive kind of impairment. The cause is the vascular or blood vessel disease, which usually affects the arteries responsible for bringing oxygen and sugar to the brain. And what happens then is that there is either a blockage in the particular vessel and artery, thereby starving the part of the brain that's fed by that artery for any oxygen, which eventually causes it to die. So strokes tend to have very specific kind of impacts, and it really just depends on where that artery was feeding for the impacts to be felt. So it doesn't generalize to saying these types of characteristics. Now, some of the things that you might see is a real sudden onset, and that the signs or symptoms of a stroke have to be present anytime you're going to give a vascular neurocognitive disorder. The various behavioral effects of strokes, once again, it's going to appear suddenly, and it's going to usually affect some sort of voluntary movements, gross speech, intellectual abilities, and it can also result in unilateral impairments like paralysis of just one side of the body. And like I said, all of this is going to be dictated by the fact of where that particular blood vessel was, whether it burst. If it burst, there's a high likelihood of death. If it's blocked, there's going to be death of that part of the brain, but the individual will survive if they have that. Neurocognitive disorder due to traumatic brain injury. If you've ever heard of TBI, that's what's referring to is traumatic brain injury. And it results from the head being involved in a collision, resulting in a displacement of the brain and the skull, usually because something hits the skull at a high rate of speed, or the skull hits something at a high rate of speed. So you can see this in auto accidents, boxing, soccer, all sorts of things that can cause concussions. And if the concussion is significant enough, you might have a traumatic brain injury. You can see on the illustration down below what happens to the brain when it has a sudden hit to the head, where the brain keeps going where the skull stops, thereby bruising that part of the brain because it hits the skull, the front of the skull, so hard. And then you have the whiplash effect where it also hits the back of the brain. So you kind of get this back and forth. And that is with a straightforward kind of head injury. Of course, you have others that maybe whip the whole brain around inside the head, and you can create bruising all over. So really, the severity of the injury is going to be rated as a function of the duration of the loss of consciousness and post-traumatic amnesia. So individuals that don't remember anything that happened, even coming up to the accident. And it usually is an accident of some sort. And you also look at the severity due to the amount of disorientation and confusion the individual is experiencing immediately after the injury. So some of you may have had the misfortune of having a concussion, and hopefully they went through a concussion protocol with you, also minimizing your mental activity for a period of time until your brain could recover, because trying to push it tends to make the recovery longer and increase the likelihood of damage. You got to be very careful when you have something like a TBI. Moving on to the next disorder is called Huntington's disease. It is an inherited disorder, as we'll be talking about. It is usually has what we call chorea, which is an unusual involuntary muscle movements that can be subtle at first, but become uncontrollable as the disorder progresses. It's an inherited disorder. It progresses to more of a sustained muscle contractions that are difficult to control. So you can see in the individuals on the right that both have Huntington's there. Movements of their face, trunk, and limbs eventually become uncontrolled, leaving the person to really writhe or grimace in the later stages of the disorder. They exhibit a variety of personality changes and symptoms of mental disorders, predominantly things like depression and anxiety. They have impairments in recent memory and learning. And that's going to be some of the more obvious kind of cognitive problems. As far as what's going on in the brain, what we're seeing is a progressive neuronal degeneration in the basal ganglia. So the basal ganglia is in charge of a lot of different things, including some of our motor movement and habits. And what we see is that the neurons just slowly, steadily degrade. You can also see some of the physical symptoms early on, looking like someone is almost drunk. Personality changes is also fairly common. And as I was saying before, this is an inherited disorder, extremely high positive family history because the Huntington's gene is a dominant one, which is very rare for inherited disorders and does not tend to strike until maybe somebody is in their 40s or 50s, sometimes even later than that, though there is some early onset. No cure at this point for Huntington's disorder, but we do have a test, a genetic test that can tell us whether you are a carrier and will eventually manifest the symptoms. The final of these neurocognitive disorders is Parkinson's disease. That is a motor system disorder caused by a degeneration of the substantia nigra and loss of dopamine. And you can see up in the left-hand corner, Muhammad Ali and Michael J. Fox are two famous, a former athlete and actor who have Parkinson's disease. Some of the symptoms you can see in the illustration there, as well as on the left, including development of tremors, rigidity. There might be postural abnormalities, decreased voluntary movement. So you might see kind of this sort of shaking. Only 20% really experience dementia, though, but it is a progressive deterioration in that one. So that's the various specific types of neurocognitive disorders. In our last module, in Module 7, what we're going to look at is the frequency of these occurring, these wide-ranging manifestations of neurocognitive disorders, some of the causes, and then how do we go about treating them.